Let's learn quickly about what is heart failure and how to clinically diagnose the heart failure and distinguish between what is left heart failure and what is right heart failure. Here you can see inability of the heart to produce cardiac output sufficient to meet the body's metabolic demand. It is called heart failure. That means maybe the heart is pumping, but the systolic pressure is too low to produce adequate amount of cardiac output. So the body is not getting enough nutrition and the body's metabolic demand is not met. So this condition is called heart failure. Anatomically, heart failure is of two types, that is left heart failure and right heart failure. To understand these two, we need to understand the anatomy of the heart first. Here you can see blood comes into the right side of the heart through the inferior vena cava and superior vena cava. Inferior vena cava drains the blood from the peripheral parts of the body, like you can see from the legs, from our abdomen, our liver, and then it drains into the right side of the heart through the inferior vena cava. So what happens if the right side of the heart cannot pump properly? Then this blood gets accumulated into these veins and then it causes peripheral edema, like the legs get swollen and we can see ascites in the abdomen and also hepatic congestion. Here we can also see blood from the upper part of their body, like our hands, and via the jugular vein it drains into the right side of the heart through the superior vena cava. So again, if the right heart failure occurs, the blood is congested into these areas. And how clinically we can see it? We will see increased jugular venous pressure. Here you can see in this picture, in case of right heart failure, no peripheral blood can be drained into the right side of the heart. So in that case, we will see peripheral pitting edema, ascites in the abdomen, hepatomegaly, and raised jugular venous pressure. And now, what happens in left heart failure? Blood from the lungs, like our left and right lung, through the pulmonary vein drains into the left side of the heart, drains into the left atrium, right? So if the left side of the heart cannot pump properly, like the left ventricle if cannot pump properly, blood gets congested through these pulmonary veins and ultimately into the lungs. So in that case, pulmonary congestion occurs, right? So what will we see clinically? So in case of left heart failure, we will see clinically there will be pulmonary edema and also there will be pleural effusion. Here you can see there will be pleural effusion, pulmonary edema. In case of left heart failure, what will be the clinical signs? There will be pulmonary congestion and also we will be able to see pleural effusion, displaced apex beat. Altogether, this right heart failure and left heart failure is termed as congestive cardiac failure. And here is an interesting thing, which is the X-ray of a patient with heart failure. If we see the above signs in a patient, we will prescribe a chest x-ray of that patient and we will be able to see the following features. These are bat wing appearance. Here you can see, and there will be curly B lines. There are some horizontal lines in the x-ray which are known as curly B signs, and there will be cardiomegaly, as you can see. There will be upper lobe diversion and also pleural effusion. If you see these signs in your patient, what investigation you will give? You can do lipid profile, B-type natriuretic peptide, chest x-ray, echocardiogram, ECG, and in further evaluation you can also give CT scan and cardiac MRI. Now, what will be the management of heart failure? At first, you need to counsel the patient about lifestyle modification, which is smoking cessation, adequate salt and fluid restriction, and restrict the alcohol, optimize the diet and exercise. And then you need to remember 3 drug, that is, at first we will give diuretics, then ACI inhibitor, and then beta blocker. This is D, A, B. If the patient is not improved by these 4 steps, then we can go for mineralocorticoid receptor antagonist, ivabradine, hydralazine plus nitrate, and device therapy. We can also go for implantable cardioverter defibrillator, left ventricular assist device, and lastly, cardiac transplantation. But nowadays, the newest agents are used, such as combination of valsartan and sacubitril. So what is sacubitril? It is angiotensin receptor neprilysin inhibitor. Neprilysin inhibitor actually inhibits the breakdown of ANP and BNP. As a result, more and more sodium and water is excreted through the urine, and thus it helps to reduce the blood volume, and thus the heart is able to pump enough blood to meet the body's requirements. That's all for today.